Hello, let's learn about how nurses play a key role in antibiotics. There is an urgent need to reduce inappropriate antibiotic usage because of the increasing antibiotic-related adverse events, worsening the antimicrobial resistance, and cross-stem difficile infection. 20 to 50% of antibiotics prescribed in acute care hospitals are either unnecessary or inappropriate. 30 to 60% of the antibiotics prescribed in ICUs are unnecessary, inappropriate, or suboptimal. Reducing high-risk antibiotics usage by 30% can lower the deadly diarrhea infections by 26%. Cephalosporins, carbapenems, fluoroquinolones, monomectins, and clindamycins are the most common culprits. Reducing unnecessary antibiotic usage of such antibiotics can decrease antibiotic resistance, C. difficile infection, medical cost, and improve patient. Exacerbated drug resistance crisis is further complicated by MDR, XDR, and PDR, multi-drug resistance, extreme drug resistance, and pan-drug resistance. The host factors, the colonization and the antibiotic pressures leading to environmental factors, bacterial mechanisms, and resistance acquisitions are making this MDR to convert to the PDR, that is pan-drug resistance and extreme drug resistance. Stewardship is a quality paradigm whose desired goal is the optimal use of antibiotics to accomplish a lower rate of resistance while achieving the most optimal clinical outcomes. Use antibiotics judiciously. How nurses play a key role now then? They make a difference in stewardship programs implementation. Nurses should be aware about the safe and appropriate use of antimicrobial drugs, including antibacterial, antifungal, antiviral, antiparasitic. Nurses play a significant role in infection control, as it is a practical, evidence-based approach which prevents patients and healthcare workers from being harmed by preventable infection and as a result of antimicrobial resistance. Why nursing community need a protocol-driven program? Over the past decade, antibiotic resistance has increased and spread dramatically throughout the world. According to CDC, antibiotic use the most common factor leading to antimicrobial resistance. The CDC estimates that every year 2 million Americans develop serious infection involving bacteria that resist one or more antibiotics. From all the studies in India with 30 acids or more, resistant rates of E. coli to third generation cephalosporins were 80% and to fluoroquinolones were over 86%. Why nursing community need a protocol-driven AMS program? Because nursing protocol and AMS has showed better outcomes in terms of reduction in resistance, transmission of multi-drug organisms, shorter hospital, and speedy recovery. The attitude, knowledge about antimicrobial stewardship and the competency leads to a better outcome, better monitoring, and better compliance among the nurses. Scope of nurses leadership stewardship program debates are nurses in stewardship, ensure pertinent information available, empower the nurses to question, reassess the therapy, reconcile the antibiotics, collect samples for culture, identify the allergy, assess the need for therapy, fungal infections, viral infections, reporting and documentation, implementation framework. Scope for nurses leadership stewardship program is extends to overall supervision, questioning the necessity of all cultures, ensuring proper culture techniques, ensuring the proper transition from IV to oral, and checking appropriateness of antibiotics. Nurses are well educated, well trained, autonomous professionals with an independent role in healthcare settings. Nurses provide 24 by 7 care and communicate daily patient clinical progress. Nurses coordinate with the medical team. Nurses review the latest lab results. They play a critical role when they know the process and can watch for the omissions also of antibiotics. Nurses are the patient advocates. They are critical in patient and family. Nurse be aware about the key information about the patient's antibiotic therapy, including indication, dosage, duration, frequency, and days of therapy. They ensure the pertinent information about the antibiotics available at the point of question the antibiotic administration route. An early switch from IV to oral helps shorten the hospital stays and reduce the risk of infection from IV catheter access. Every day, the nurses assess the patient's IV antibiotic therapy for appropriateness. The nurse should be empowered to inquire about changing or stopping the therapy when appropriate, as this enables to drive the curiosity question from nurses to clarify doubts. Then to reassess the antibiotic therapy in 2 to 3 days. Empirical therapy is initiated before the microbiological information. Hence, nurses proactively assess for the culture report within 24 to 48 hours and advocate for the narrow spectrum antibiotics, and also plays a vital role in identifying and preventing side effects and toxicity. This wasn't adequate when a patient in transplant developed new C. difficile diagnosis. He made sure to review the prescribed antibiotic regimen was reviewed and prevention was made and antibiotic de-escalated. This helped the patient recover fast from the infection. Early detection and appropriate treatment is the key. And reconciling the antibiotics during all patient care transition. Moving the locus of care among sites and providers are common. Hence, direct care nurses should discuss the indication, the duration with other nurses during each change of shift report. Also, get clear report from doctors regarding continuation of the antibiotics, both at ward to ward or ward to ICU, ICU ward and ward ICU to diagnostic areas. Now, what are the do's and don'ts of the culture collection of the sample for cultures? Clean the catheter with an alcohol pad. Use the sterile needle and syringe to quench the tubing, or use the urine vacuum. Aspirate the urine directly from the tubing. Transfer the urine to a sterile container or appropriate transport medium. And don'ts include: do not culture the catheter tips. Culture urine from the drainage bag should avoid it, because the growth of the bacteria outside the catheter may have occurred at this site. Correlation of the respiratory culture. Analyze if the patient needs a respiratory culture. So this can be done well by the nurses. They are very much familiar with the definition of the pneumonia when the patient reports or develops respiratory symptoms. Consider other etiologies before obtaining a respiratory cultures. Do not send the respiratory samples for cultures when there is no concern for it. Regarding collection of the fungal samples, preparation of the patient, collection of the specimen, processing the specimen and storing and regarding viral samples, preparation of the articles, appropriate PPE, collection of samples, proper sealing of package, timely and safe. Regarding identification of allergies like penicillin allergies, educate the patients about penicillin allergy, access for the date, time of incident, what and how did it happen, what are the antibiotics, learn the differences between HUEs and the delayed macropapillary rash. The components needed for an effective protocol includes the antimicrobial nursing team development. A team consisting of Directorate of Nursing, Chief Nursing Officer, HIC nurse or HIC link nurses, HIC committee members. The role of the nurse antimicrobial stewardship champions is to identify nurse who champion who take the responsibilities in developing, implementing, and evaluating the process. Provide education and training about antimicrobial stewardship to resident care staff, including the public. The regular surveillance will be carried out by the stewardship nursing team. Antimicrobial stewardship communicate with letters, brochures, pamphlets, emails, small gathering, and communicate through the ISBAR. To summarize, IPC nursing protocol on AMS complements success of hospital's antimicrobial program. Our organization shall empower nursing leaders to be an active part of stewardship program. Nursing leaders identify and form a committee to develop nursing protocol on AMS. The nursing champions take the ownership of implementation of the protocol. Nurses are being celebrated for successful outcomes of the stewardship program, and the outcomes are disseminated for further learning, which enables sustainability of the. Thank you.